Hey guys! Today we're going to talk about the history of medicine, and this video includes the main points that you might need to know for your interviews.
Okay, we can call this part of the timeline the birth of medicine. First, Imhotep. He was the first recorded physician in ancient history, and he made anatomical observations, ailments and cures, including cases such as 27 head injuries and 7 throat and neck injuries. Next is Hippocrates, and he was a Greek physician and is called the father of medicine. He made the Hippocratic Oath. It's outdated now, but it forms part of the GMC, the Good Medical Practice, and he came up with the theory of humorism, that the body is made of 4 humours: black bile, yellow bile, phlegm and blood, and if you have a healthy balance of them, then you are healthy. He also explained diseases using environmental factors, diet and lifestyle.
Next was the Roman Empire. During this time, the first civilization with a health system was put in place, which had a sewage system and aqueducts. Also, they had baths for the public as well as lavatories. They drained marshes to get rid of mosquitoes that cause malaria. Galen of Pergamon was present at this time, and he was a supporter of humorism, like Hippocrates, and he was one of the greatest surgeons in the ancient world, and he did brain and eye surgery. He also did vivisection and dissection on animals, and he found that the anatomy closely mirrored humans.
In 750 AD, there was a French Norman invasion into England. This led to the introduction of hospitals and medical schools that taught about Greek and Arab physicians. Hospitals began appearing. Hippocrates' work and other findings were translated into Arabic. Raises questioned the validity of humorism, and he was the first person to differentiate between smallpox from measles, and he discovered alcohol. The 750 AD led to a more evidence-based approach to different findings, because Hippocrates didn't have as much evidence to go towards his theory of humorism.
So next we're going to talk about the 16th and 17th centuries. So towards the beginning, Leonardo da Vinci did autopsies on convicted criminals and made drawings to increase our understanding of human anatomy. Then Girolamo Fracastoro suggested that epidemic diseases were caused by objects outside the body. Then Andreas Vesalius made a complete textbook on human anatomy, and Ambroise Paré believed in dressing wounds and tying off blood vessels, and he was the first person to design artificial hands and limbs. William Harvey later explained circulation of blood in veins and arteries, and he found that the heart pumped blood around the body. Anton van Leeuwenhoek invented the microscope and discovered red blood cells, and later Richard Lower did the first blood transfusion on a patient.
So in the 18th century, the beginning of this is 17th century, but Thomas Willis discovered the presence of sugar in urine of diabetes patients, and he researched the anatomy of the brain, nervous system and muscles. He created the term neurology. James Lind proved that scurvy could be cured by eating citrus fruits. Edward Jenner developed the smallpox vaccine, which has now been eradicated, but there were many problems still with this, still in the medical world. For example, bleeding and purging still was used to treat people. Syphilis was treated with mercury, which is extremely toxic, and physicians lost patients when trying new techniques. An example that we can give of poor treatment was by King Charles in this century, and when he became ill, they actually let 34 ounces of his blood, and also induced vomiting, and this eventually led to his death.
In the 19th century, 4 main developments were made in medicine. One of these was cell theory, and this states that all living things are made of cells. This included the improvement of microscopes, which meant that people could study tissues and cells in more detail, and this led to cytology, the new science of cells. Rudolf Virchow showed that changes in cells can cause diseases like cancer. Another development was in anaesthesia. Paracelsus made chickens breathe sweet vitriol and they felt no pain, so vitriol was then used as an anaesthetic until 1842, where it was decided that it was too dangerous, so it was replaced by chloroform, which was given to Queen Victoria. However, it wasn't very safe and it caused many deaths. Another development was in germ theory, and it was recognised that diseases were spread by contagion. John Snow traced the source of cholera to water contaminated by sewage, and later Louis Pasteur found that that germs were everywhere and in the air, and he developed pasteurization. He also developed vaccines against anthrax and rabies. Next is antiseptics. Ignaz Semmelweis discovered that infections in obstetrics units after childbirth were most likely due to poor hand washing by doctors. And in the late 1860s, Joseph Lister helped reduce the rate of death from gangrene by dipping bandages into carbolic acid and pouring it into wounds, as well as after surgery. And this started the use of antiseptic surgery.
20th century. Röntgen discovered X-rays, and Einthoven made the first ECG, first artificial kidney. There was ultrasound imaging made, flexible endoscopes made, introduction to keyhole surgery, CT scans invented, MRI scans, first artificial heart implanted. There was also a better understanding of the immune system and genetics. Paul Ehrlich believed in the existence of antibodies. Autoimmune disorders were recognised, and the DNA structure was decoded by Watson and Crick. So there was testing for diseases using DNA and the creation of natural drugs using the DNA code.
This section shows the very pharmacology of the 20th century.
Then why don't you leave it?
This slide shows the development of pharmacology during the 20th century. Pause the video if you need to.
This is a general timeline before the NHS. Please pause the video if you want to look at this in more detail.
So why was the NHS made in the end? There was a view that healthcare was a right, and voluntary hospitals had financial difficulties. Also, the impact of World War II made it possible to transform the system. In 1938, an emergency medical service was made due to the war, and in 1942, the Beveridge Report described the need for welfare in poorer areas. After the Labour Party won the 1945 election, the Health Minister decided to nationalise all hospitals, and in 1948, the NHS was formed.
Just to finish off, I'm just going to say the 3 principles of the NHS because I don't think we've ever said them and they're quite important. So this is the way the NHS is run, and this is what was said when the NHS was formed. So it needs to meet the needs of everyone. It needs to be free at the point of delivery, and that it needs to be based on clinical need and not ability to pay.
Thank you for watching, and I hope you enjoyed our video. Make sure to learn these details very well for your interviews because you could be asked. Bye!
Thanks for watching, bye!